Tell us a little bit about some of the concepts that are in it. For those people that aren't familiar with the book, what would you kind of briefly just, help them understand that they'll find in it?
The objectives are to give people, I guess, a sense of opportunity and a sense of possibility through understanding some of the basics of how pain works. And it's intentionally striking, so that people with chronic pain come with all sorts of challenges and all sorts of skills. And sometimes the written word doesn't land with them. Sometimes they can't read, but the images in it provide an opportunity for the clinician to talk through the relevant points. So the key messages are, I guess, and it's hard for me to talk to that and not talk to where we're at now in the field, right? And we're evolving very quickly. Explain Pain remains, I think, a great anchor because we're still up to date. But the key messages are that the nervous and immune systems are highly sophisticated, that pain is a protective output of our system, or in Explain Pain we talk about it's a protective output of the brain. It's not a signal that comes from the tissues of the body. And even that concept is terrifically challenging. Mm-hmm. But if we can use groovy images that are scientifically based, the book is loaded with references. It's a highly credible source, I think. But that's a tricky one to get around. So I guess that's the first one. And the next key concept is that the sensitivity of that system, almost like your protection setting, varies. And it varies moment by moment and over minutes, days, weeks, months, years. And there's a whole range of inputs that are relevant to that. And that takes to the third concept, which is ultimately that pain is a biopsychosocial phenomenon. Anything that's relevant to protecting your body has the capacity to turn pain up or turn pain down.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.